Hello guys, today's lesson is about iodine deficiency disease, about endemic goiter and the cretinism. A goiter is an enlargement of the thyroid gland, and a normal thyroid gland volume is approximately 1 ml at birth, and it increases with age and the body mass index. The rule of thumb can be used to evaluate the size of the thyroid in older children more than 5 years, with each lobe of the child's thyroid gland approximating the size of the distal phalanx of the child's thumb. Children with enlarged thyroid can have either normal function of the gland or underproduction of the thyroid hormone or overproduction of the thyroid hormone. So goiter cannot tell us anything about the level of function of the thyroid gland. It can be euthyroidism, hypothyroidism, or hyperthyroidism despite enlarged thyroid gland. When we see the etiology of iodine deficiency, goiter caused by iodine deficiency is termed endemic goiter, while cretinism refers to the clinical manifestation of severe hypothyroidism in early life. The thyroid gland can overcome a moderate deficiency of iodine by increasing the efficiency of the thyroid hormone synthesis. Iodine liberated in peripheral tissues is returned rapidly to the gland, which increases the rate of thyroid hormone synthesis and produces higher proportion of T3 and T4. This increased activity is achieved by compensatory thyroid hypertrophy and hyperplasia, or by formation of goiter. In areas of severe iodine deficiency, these compensatory mechanisms are insufficient and hypothyroidism can result. WHO estimates that nearly 2 billion individuals currently have sufficient iodine intake, including 1/3 of the world's school-age children. Thus, despite great progress in global effort to reduce iodine deficiency, it remains the leading cause of preventable intellectual disability worldwide. The recommended dietary allowance of iodine is, for those less than 6 months, around 110 microgram per day. For infants up to 12 months, around 130 microgram per day. And for children up to 18 years, around 90 microgram per day. And for older children, it's around 120 microgram per day. It increases during pregnancy and lactation. During pregnancy, it's around 220 microgram per day. When we see the clinical manifestation of iodine deficiency, in mild iodine deficiency, the thyroid enlargement generally is not noticeable except when demand for thyroid hormone synthesis is increased, such as during rapid growth in adolescence and during pregnancy. In regions of moderate iodine deficiency, goiter observed in school children can disappear with maturity and reappear during pregnancy or lactation. Iodine deficiency goiters are more common in girls than in boys. Serum T4 levels are often low in persons with endemic goiter, although clinical hypothyroidism is rare. Despite low serum T4 levels, serum TSH concentration are often normal or only moderately increased due to elevation or elevated circulating levels of T3. In fact, T3 levels are elevated even in patients with normal T4 levels, reflecting the fact that iodine deficiency leads to preferential secretion of T3 by thyroid and an adaptive increase in peripheral T4 to T3 conversion. Endemic cretinism is the most serious consequence of iodine deficiency, and it occurs only in geographic association with endemic goiter. The term endemic cretinism includes two different but overlapping syndromes, a neurologic and a myxedematous type. The incidence of the two types varies among different populations. However, both types are found in all endemic areas, and some persons have intermediate or mixed features. When we see the clinical manifestation of the neurologic syndrome, it is characterized by intellectual disability, deaf mutism, disturbance in standing and the gait, and pyramidal signs such as clonus of the foot, the Babinski sign, and the pateral hyperreflexia. Affected persons in the case of neurologic syndromes are goiterous, but have little or no impaired thyroid function and have normal pubertal development and adult stature. When we see persons with myxedematous syndrome, they have also some syndromes of neurologic features such as some intellectual disability, deaf, and also some other neurologic symptoms. But in contrast to the neurologic type, they have delayed growth and sexual development, myxedema, absence of goiter, and deranged thyroid function such as serum T4 levels to become low and the TSH levels to become markedly elevated. Delayed skeletal maturation may extend into 30 decades or later, and ultrasonographic examination shows thyroid atrophy in the case of mixed dermatitis syndrome, whereas in the case of neurologic type, they are goiterous. When we see the pathogenesis of neurologic syndrome is attributed to maternal iodine deficiency and hypothyroxemia during pregnancy, leading to fetal and postnatal hypothyroidism. There is evidence for the presence of thyroid hormone receptors in the fetal brain as early as 7 weeks of gestation. Although the normal fetal thyroid gland does not begin to produce significant amounts of thyroid hormone until mid-gestation, there is measurable T4 in the coelomic fluid as early as 6 weeks, almost maternal origin, and this supports a role of maternal thyroid hormone in fetal brain development in the first trimester. Intake of iodine after birth is often sufficient for normal or only minimal impaired thyroid functions that are seen on those who are having neurologic syndromes, because they have normal thyroid function test when measured. The pathogenesis of mixed dermatitis syndrome leading to thyroid atrophy is less well understood, but there is additional environmental factors that might provoke continuing postnatal hypothyroidism, such as selenium deficiency, goiterogenic foods, thiocyanate, Yersinia infection, thyroid autoimmunity. It might play a role as provoking continuing postnatal hypothyroidism and causing mixed dermatitis syndrome with hypothyroidism and also atrophy of the thyroid gland. Regarding treatment, in many developing countries, administration of single intramuscular injection of iodinated poppy seed oil to women prevents iodine deficiency during future pregnancy for approximately 5 years. This form of therapy given to children younger than 4 years of age with mixed dermatitis cretinism resulted in euthyroid state in 5 months. Older children respond poorly and adults not at all to iodized oil injections, indicating an inability of the thyroid gland to synthesize hormone, and these patients require treatment with T4. So they should be treated as hypothyroidism with hormonal treatment with T4. Through the efforts of WHO and its program of universal salt iodization, the number of households worldwide with access to adequately iodized salt has increased from less than 10% in 1990 to 70% nowadays. In certain areas of the world, where the usual methods of iodine supplementation had failed, iodination of irrigation water has increased iodine levels in soil, animals, and human beings. In other places, iodinated salt in school meal programs gives children the dietary iodine they need. This is what I have regarding iodine deficiency. Thank you for watching.